Hello everyone, I'm Dr. Shireen and welcome back to our initiative, What After Dentistry. As you all know, this is a platform where we have interactive sessions with industry guests and then we talk about various career options that are available in dentistry and in healthcare. So today we have with us Dr. Roshith, who is a practicing dentist and an implantologist in UK since 2005. He completed his MDS in oral surgery in 2000, and then after working as a maxillofacial surgeon for a few years, he moved to UK in 2005. Dr. Roshith has worked all around the country in various NHS hospitals for 5 years as a senior house officer and staff grade. He did his PG diploma in implants from Royal College of Surgeons of England, London in 2010 and has been practicing implantology since then. Dr. Roshith presents an implant course also on All on 6 in London. He does a lot of mentoring for his junior colleagues and who are basically interested in implants. Apart from this, he is also a founder, president of Association of Indian Dentists UK and have conducted 3 major annual functions in London and Birmingham with hands-on CPD courses. He's actively involved in helping overseas dentists to come to the UK and pursue their career in dentistry. We welcome you, Dr. Roshith, to join us today on our platform and share your experiences. And we are really excited to discuss the scope and opportunities in the UK after BDS and MDS. So welcome once again.
Thank you, Sharon, for the lovely introduction. Right. As Sharon said, I've been contacted by a lot of people and actively involved in helping people within my limits, obviously, to come and pursue their career in the UK. Right. So basically, we'll start off. Shirin sent me some discussion questions, so I thought I will go through that first, and so that will more or less cover the whole thing. So she wanted me to discuss myself and my journey so far in the industry in the UK. As Shirin already had described in my intro, I came to this country. No, I finished my BDS back in 1997, and then I've done my master's in oral surgery, which I finished in 2000. I worked in the hospitals back in India and Dubai before moving to UK in 2005. When I came here, I worked in the various hospitals as senior house officer, almost like around about 5 years. So those times was easier times. Unfortunately, the things have made it a bit more difficult for people to come now. But there are still a lot of involved we can do something to come and work here. So those times we can work in the hospitals without the permanent registration, and I came like that. I worked in the hospital for 3-4 years before I did my ORE examination, and then I got into the primary care, and then I worked for other people for a long time before I bought my own practice and started working. And this is how my journey so far. Step-by-step procedure now. This is the most difficult question because there are a few ways which I will actually go through in the presentation. But there are 3 usual ways. The one way is the most the predictable way, I would say, is passing the ORE examination, which is the Overseas Registration Examination with the General Dental Council, and come here and start working as a dentist. Now, that's the easiest way. Well, that's the not the easiest way. That's the most predictable way. You will get a job and career in the UK. But coming to that, it's not an easy process of passing the exam. And then obviously the other options I will tell you over the course of the presentation. Okay, now how can you prepare? Okay, you can prepare for ORE. There are coaching centers in India, and there are online courses as well now. And there are also a lot of Facebook groups, which is actually actively involved letting you know how to prepare for it. And there are lots of ORE groups. So if you type in the Facebook, just say ORE preparation groups, there are a lot many. And I will send you some links of the coaching centers in India and online in the presentation, so you can actually take it down from uh, I can share it to Sharon, and then you can take it from Sharon later on. Okay. um, Explain the visa routes that are available. Yeah, the visa routes, I will tell you again, there are no particular visa route for dentists as such. But if you pass the examination, the ORE examination, you will get a job. And once you get a job, obviously you will get a work visa. There will be a time bound, like a bond with that particular person who is giving you the or providing you the visa, of say to 3 to 5 years bond with the particular gentleman, particular people who are giving you the job. Okay, that's one of the ways. There are There's no other way actually, to be honest. Which I will tell you. Well, there's one more way, but that's not the usual way. Okay. After clearing ORE, okay, how can one prepare for part two? Again, there are courses within the UK and in India. There are a few centers in Bombay and Mumbai and Pune. Um, I think they're planning to start one in Delhi as well. Um, there Actually, one of my friend is actually planning to start one in South India as well. Okay, so in Karnataka, in Mangalore. So that's the things. Then you also have preparatory courses in for the part two. They can stay in the UK as long as their tourist visa is valid, obviously, but then it's only for 6 months.
Mhm.
You will not be normally will be if you are very lucky, then you might finish off within that 6 months, but it's very difficult to get finish off the part one and part two in 6 months. That will be a miracle actually if you can do that. Um, i will i will go through that actually. Okay, again, the other questions was okay, once part one and two are completed, okay, now what is the next step? How can a dentist get a job or look for one after registering with the GDC as a dentist? Again, very, very important question. Um, After passing out part one and part two, it is still a bit of a difficulty actually. They made the rules a bit difficult for people who come in to and work here. So basically, after one and two or once you completed ORE, you need to do something called PLVE or VTE, that is called vocational training equivalence. Now, I'll tell you exactly what it is. Basically, it is an internship, exactly like the internship back in India. So you will be working under somebody as a mentor for 1 year. So if you have any trouble, if you have any questions or anything, you can ask them. They are your trainer. You pay an amount for them as well, and they'll train you. And there is mandatory trainings you have to go through along with the trainer to get in that 1 year period. And then after the 1 year, you will have to present a portfolio to the deanery, and then the portfolio will be assessed, and they say, okay, now you're ready to go ahead and work as an individual dentist. They will give you a performer number. That number With that number, you can work anywhere. Then you are individual, and you can independently start working anywhere you wanted to, 1 day or 2 day or 3 day, whatever you wanted to. Until you get that performer number, the life is a bit difficult, because these PLV or the VTE positions are not very common. Now, once the people who pass out from the UK, the government has a welcome to Shivani. Shivani is actually, hi Shivani.
I don't.
Shivani is, hi. Shivani is actively involved in the and the recruitment of people from the UK, and also she is the overseas recruitment head in My Dentist, which is one of the biggest group in the world, actually. They have around about 650 practices in the UK. And Shivani happens to be my friend, and she's the head of the recruitment head in overseas dentists. Okay, so she'll be a good, addition to this particular group. Um, okay, so Shivani, we were just going through the questions which Shirin had sent me. So I was just
Yeah.
explaining them.
That, thank you.
Yeah. So we were in the PLV section, how they do that. So because people who pass out from the UK have a particular VT, that's vocational training posts the government has allocated. Unfortunately for the VTE or from the overseas dentist, they don't have a particular um, post as such. So we have to make one, and also there are a lot of paperwork, and it involves in a lot of time consuming paperwork, and people normally people won't go through all that. Might as well take somebody who's already got the performer number. So PLVE as such is a difficult job to get in, or the position to get in. So it is difficult, but the main point at this particular juncture is actually they all need UK needs a lot of dentists. Okay, and Indian dentists are one of the most preferred dentists, because we are, as Tom Real, he's the CEO of My Dentist, he always say Indian dentists are one of the most um, uh, hardworking, uh, English speaking, um, and able dentist in the world. That's what he says. This is his own words. So he is very much into Indian dentists, and he actually prefers Indian dentists. Okay, so that is another thing. They have some PLVE positions, designated for the people who are coming from overseas. So, which Shivani can give a little more in-depth information once we finish this one. Okay, so that's another thing. So, okay, once you finish, then obviously once you finish the PLVE, and once you get your performer number, you're an individual dentist. You can work either in the same place or anywhere you want it. Is it the process same as the MDS graduate from India? How do they practice the specialty in the UK? That's another big question. Unfortunately, there is no system like MDS. It's not valid here. So even if you've done in MDS back in India, you have to still go through the ORE examination, and then since you are trained as an MDS or in your particular area of interest, you will be able to work here as a dentist with special interest in that particular field, which I actually am working, because I'm an oral surgeon back in India, and I'm working as an oral surgeon with a special interest in here, because I'm doing minor oral surgical procedures in the NHS as well. So that is one thing you can think about, but it is not valid or a particular degree or anything, or there is no exemption for the examinations here, unfortunately. How much is the total cost? That is a very good question. The whole process, we have no idea. It depends on how many times you fail. I can put it that way. The cost I am going through in the usual cost for it's 290, I think, for the year part one. I'll go through that again, and then 2,750 or something like that for the part B. Then the training, you need to go for the training courses, which is also quite high priced. I don't know the prices of that, but there are varied costs. But then it depends on how many times you have to sit for the ORE part two. Part one is comparatively easier because it's a theoretical exam, and we Indians are very good in theory. Yeah, but when it comes to practical, it is not that we are not good in the practical, but the exam itself is very strict. It's a very highly scrutinized exam, and around about 10% is the pass rate. They're very strict on that. It's not because you don't know how to place a class 2 or class 3. It's all because on the day you are not lucky enough to pass it. That's all. Okay, so it depends on how many times you sit for the exam. How is the scope of dentistry in the UK? Yeah, that I already I told you. There is a high demand for a dentist because few reasons. One, obviously, the Brexit is happening, and in another one more year, is that right, Shivani? One more year,
Yeah.
yeah, in another one more year, yeah, yeah.
It
The
would it sorry it will
yeah, go on.
it's dire need of dentists in UK, and we have already seen European dentists are decreasing, so it is good chances.
Exactly, because the European dentists, now this is the funny thing. European dentists used to be infiltrated very, very vast amount here because of the COVID. Sorry, COVID, because of the Brexit. More or less same, isn't it? So the European dentists are going back, and because they have to also sit from one more year. The government is the GDC has given one more year of leeway for them to stay. After 1 year, they also have to sit the ORE examination and the IELTS examination. Before the ORE examination, they have to sit the IELTS examination. 100% sure, none of them will pass the IELTS exam. Forget about the ORE examination, because it's very difficult. IELTS is not as as you think. It's a difficult examination, and also none of the European dentists are going. There will be one or two, but not as many as Indian dentists do. Actually, that's why, as Tom said, best hardworking and English speaking dentists in the world. Um, and Yeah, so once that happens, there are already shortage of dentists here, so they have to relax some of the rules which they are planning. So there is a good chance, and this is the right time to come to UK. Okay, so that's the scope of the dentistry is very high at this point of time. Okay, last tip or advice every dental dentist should follow according to, okay, don't take dentistry. That's the last tip. Okay, so in India it's getting very, very bad, isn't it? The situation is bad. So if you have not already taken, please don't take it. That will be the last tip I could give. Okay, so these are the one academy I've just telling you, which are giving some of the what's it called, the training for the for ORE, and they also provide full help to come to the UK regarding the registration with the GDC as a therapist and everything. They'll give you all the, but obviously there are money involved. But there is another one which I can which Shivani will tell you in the end, which might probably will be very better than this route. Um, to work as a dentist, now this is the most important thing. As I said earlier, you have to pass the ORE examination, overseas registration examination, or LDS examination conducted by the Royal College of Surgeons of England. Um, More or less exactly the same. The format and everything is more or less exactly the same. There are few very subtle differences in between, which I will go through. So unless you pass either of these examinations, you cannot work as a dentist in this country so far. The rules might change in the future, but so far this is what it is. Now, how is ORE done? It is conducted by General Dental Council, UK. That's the website. It's done in two parts, part one and part two. As I said, part one is a theory examination, and it is conducted twice a year, April and August. It needs to be booked online 3 to 4 months before. And part one fees around about 750, corrected. Sorry, it was, yeah, 750. The documents needed to apply are, there are a few documents which is definitely, which again, you will get it from the website of GDC, but I'm just thought I will just also put it here. You need to pass the IELTS, not passing. IELTS exam doesn't have pass and fail. You need to get particular scores. The scores, it has to be in academic 7 overall and 6.5 minimum in each part of the examination. Okay, and you should have a good standing certificate from the place where you're working, which has to be valid in the in the last 3 months. It's only valid for 3 months, so it has to be taken very recent one. You need to have a transcript of the certificates of all your degree certificates. you need to have a syllabus from your university and the year which you did. Say if you've done the BDS in 2011 to 2015, you have to get that particular syllabus from the 2011 to 2015. So that's NARIC certificate. Again, it is an authority. They'll go through our certificates and they validate our certificate, and attested copy of your degree certificates. And okay, now we're going to the part 2. This is the practical. Part 1, as I said, is a part just a theory examination. And they might be making it online now because it's easier to make it online. But again, it's only twice in a year. And it needs to be booked 3 to 4 months in advance. Part 2 is the most difficult one comparatively. It's a practical exam conducted 3 times a year by the GDC for the ORE. For the LDS, that's the subtle difference. I told you, LDS, we have only once a year. That's a very important thing to think about. It's only once a year, whereas the ORE is 3 times a year. It contains 4 parts: medical emergencies, dental mannequin, OSCE. You get all this information from the website. To be honest with you, I don't have to go through all this detail. I just thought I'll just go through the easy bits. Medical emergency, mannequin. This mannequin, dental mannequin, is the place where you need to do the practical examination of preparing a class 2, class 3 root canal, anything. OSCE examination, that's called that where you go through different stations and you write down your points, and they will be asking you questions, and there will be actors. I'll go through that one. Then the final one is the diagnosis and treatment planning of a particular patient who is coming with symptoms. Okay, the fee is around about 2,930. I don't know whether it's changed now. So you need to pass each session separately, all these 4 of them separately, except the medical emergency. Say if you passed all the 3, like diagnosis, treatment planning, OSCE, and mannequin, you passed, but you only failed for the medical emergency, then you will be given 1 more leeway. You can do the medical emergency 1 more time, and if you can pass it, you can go through. But if you lose any of the mannequin or OSCE or diagnosis, you have to do the whole over again. Okay. Mannequin exercise to perform. It's a 2-hour examination. There will be 2 major procedures or a minor procedure to do. The guidelines and syllabus is available on the GDC website. Everything is available on that. What you be asked, everything will be there. And it's done on the phantom head. It's a very structured and a very fair examination, I would say. OSCE, again, this is one of the examination which Indian dentists will be not very familiar with. It's an objective, structured clinical examination. And there will be 20 stations. So you have to just basically walk around these 20 stations. Each station will be 5 or 10 minute stations, and there will be actors. And there'll be sometimes there will have procedures to perform, like say suturing or hand washing and things like that. And I'm sure hand washing everybody will pass, especially now. And there will be spotters. They will be asking instruments, and you need to say a few things about what exactly that instrument is used for and stuff like that. There will be X-rays and photos of clinical pictures. You need to diagnose. There will be tests for a clinical and community. So basically, it's about communication skill and your clinical thing. So there will be actors. The actors will actually will tell you about signs and symptoms. So you need to order the investigations needed for the things, and then they will actually provide all of them if there is any investigations already done. So need to make a diagnosis with a presentation and formulate a treatment plan. This is basically for this is for the diagnosis and treatment plan. So there will be an actor with the signs and symptoms. You will be provided with all the investigations provided. If it is not provided, you can ask for it. So that's one of the tests they do actually. So whether you're asking for that particular, investigation, and then you need to make a diagnosis with that presentation, and then formulate a treatment plan. Then you will be given a time to formulate a treatment plan for that particular patient. And now actors actually will mark you for your communication skill, whether you're talking, whether he understands it. That's very important, because obviously you will be talking to your own patients, and if they don't understand what you're saying, that's not right, is it? So they will mark you for that. Medical emergency, it's a resuscitation. It's all in the Resuscitation Council website. It's a scenario where there is a patient is being collapsed or whatever, and then you need to, know more about medical emergency drugs and doses, everything about what what we will normally use in the dental scenario here. Yeah, as I said, you can sit one more time if you didn't pass. If you passed all of the other things and just didn't pass the medical emergency, you can sit one more time.
So we somehow lost the recording of the second part, some parts of this, the second part of this session. So luckily I had certain notes with me, and and Dr. Roshith shared his presentation with me. So I will just walk you through few slides to get you understand what are the various other routes, and of course about this LDS exam. So I hope that till now you got the information about the ORE. The second exam, as Dr. Roshith in the initial session, he said that this is the second exam that you can give if you want to practice dentistry in the UK. So LDS is it's again a licensure exam that is conducted by Royal College of Surgeons of England, London. Again, if you already see on the screen what is the subscription fee for this. So that's the application fee. As such, there is no structured syllabus that is given for LDS, but almost it's like same on the same lines of how ORE is conducted. The only differences and some minute changes, but the difference as such is that in LDS it's again it is conducted only once a year, and you can give it like for 5 times. So 5 attempts you can give for LDS, and it's done every year, once in every year. So that's the overall thing. The preparation and the exam pattern is almost similar to ORE, right? And as Dr. Roshith mentioned, that there are a lot of groups available in Facebook where you can ask about how to prepare and everything. So you can search for LDS preparation groups, you can search for ORE preparation groups, and you can communicate with the group members and get to know more about the exam pattern. The other pathways that he mentioned to reach UK, if you don't want to give ORE at the first hand, is either you can work as a dental therapist, so you can give your application for a dental therapist. Now if you want to work as a dental therapist, you generally don't have to go for any examination. It is only a very rigorous application process that is being followed if you want to work as a dental therapist. Luckily, we are also coming up with an interactive session with one of the practicing dental therapists in the UK, so that you get more exposure to what are the various roles and responsibilities of a dental therapist and a hygienist, what is the difference between the two, and how you can apply for it. So the entire application process and everything can be, you can get it from our other session. So the other way, so one is dental therapist. The third way is postgraduate study. Postgraduate is if you want to pursue any masters, in masters in dentistry, which eventually Dr. Roshith will be talking about, and luckily we have that part of the session. So Dr. Roshith will be explaining about that master's program. Then as a specialist, if you want to come, and then as a research or scholarship. So specialist in research scholarship, he mentioned that there are not much avenues in this, but the other, apart from ORE, LDS, these are the other two areas where you can try working as either as a dental therapist, or you can pursue a master's program. And then while you're pursuing that master program, you can prepare yourself for ORE, give the ORE, and thereby then you can practice as a dentist. So that's how basically these are the other pathways by which you can usually you can reach UK and then start practicing dentistry. So these are the two links he is mentioning where this will help you to get more information on the dental hygienist part, that how to register and what all. This is the link, you can note this down. I will also mention all the relevant links that he has mentioned in the presentation in the description box for you guys, so you can check out from the description itself. This is another link that he has mentioned, which is an additional documents that are required and the additional process things that are required. So for the registration with the GDC, so that's this is another link that you can refer to. All these links will be there in the description for your reference. then this is the last, almost the last part of the session that we had, wherein he talked about My Dentist. Now, My Dentist is a biggest dental corporate in the Europe. Remember, while during the session, the first half of the session, we have Shivani with us. So even by the end of the session, also she'll be there, and she'll be also talking about My Dentist. So this is basically, she's one of the she's the recruitment head in with My Dentist. So this is one of the biggest dental corporates in the Europe. They have around 700 dental practices all around the UK, as you can see it, and they provide placements. They basically help the dentist, who have passed ORE. They basically provide the dentist opportunities. They also, now they have recently also, they've started providing placements for dental therapists and hygienists. Though they have limited placements, but then they help Indian dentists who want to work as a therapist or hygienist. They help with the job placements. The only thing is, I think, they have a bond. If you want to work with them as a dentist, they have 3 years bond, as they mentioned. They're a very good employer, as Dr. Roshith has, he said earlier also. So one of the best employers to work with. They support you and provide courses for the training for ORE. You can also continue working as a therapist, and if you have not passed ORE, for example. So generally, they help you with all the visa processing. Not exactly so visa in the sense like a permanent residency. Also, they help you with the PLV, VT. They help you with the dental therapy. So everything, once you give your application, they help you with the job placement of a dental therapist. They help you with the placements of as a dentist if you want to work with them. They do provide that opportunity also, as and when they have. Also, they help you with the training material on ORE. So if you want an exhaustive, they provide supporting courses for training ORE. So they have a great support team. They have a lot of online free courses. The academy is there to provide hands-on training. A lot of dental awards have been won by the clinicians. You can always search in the Google about My Dentist. I will also share the link in the description so that you guys can check out and you can see what all they do. And they're one of the best, corporate chains, dental corporate chains that is there in the UK and Europe. So they also help you with the dental therapist registration, as I mentioned before. So once you have registered with the GDC, these are the email IDs that you can reach out to, and they will further help you with the process and also with preparation as an ORE, or if you want to work as a dental therapist. So these are the two email IDs. The top one is Bhandari, is the Shivani's mail ID. So I will be sharing in the description. You can check that out. So this is the PG study, that postgraduate study, as I mentioned, and from here Dr. Roshith will be taking up.
Right behind it. Okay, now PG study. Okay, you can do PG study in the UK. There is one course which I have recommended for you. I don't know anybody up there, or I'm not getting any anything out of this, but I heard this is a good course, so I thought Raj Ryan, who is doing the course, has been a very famous guy. So it's a distant learning to blend, and I think it is a full-time course right now. For 1 year, it was 18,000. I think they have increased it now. It is in Ulster University, isn't it? It is now 20 something, isn't it?
25,000.
Oh dear. Okay, this was last year. So every year, yeah. But it is what I heard is 4 of my friends are doing this, and they are very happy about this particular course. It's an advanced general dental practice course by COMD, and that's the link if you wanted to. Advantage of doing. Okay, now why I would say this pathway is another way of coming here. You will get a visa for the dependent. Okay, so unless as long as your course is 1 year duration, you get a visa for 1 year, and also your dependent can also come. Wife, children, everybody can come. Classes are only for 3 to 4 days a week, and you can work other days as a part-time. Can earn a decent money. And also after the 1 year study, you get a post-study visa for 2 years. So you can extend the visa for another. So you get total 3 years staying in the UK. So if you are registered as a therapist, you can work part-time as a therapist, and then make the money, as well as your dependent husband or wife can work alongside you and help each other. And then you can pass your ORE within that 3 years time. Then you will also get through get into the job as well. There are many other MSc courses available as well. It's not just this particular one. I know this course, and then I just told you about. There are public dental health ones, forensic dentist, anything you can take, can Google and find out various universities. They might be cheaper than this one because this is quite a lot of money, £25,000. Then you can also get the research and scholarship available too. This is the COMD website, and thank you. Still remember, I made this presentation while I was in the backwaters of Kerala. I took a picture right then and put it there. So, yeah.
Could you please go on that LDS, examination where you explained?
Yeah.
Just few questions that I would like to.
Yeah, there you go.
So now, when you say that this examination is there for once every year, right? So are there any rules that you can only give like 2 attempts or 3 attempts, or someone can try like n number of times?
No, there is a cap of 5 times, isn't it? Am I right, Shivani?
Yes, that's right. 5 times.
5 times. You can only write 5 times, and if you can't clear in that 5 times, you are not able to. You won't be able to.
Okay.
And
similarly,
but you can do one thing. You can try LDS for 5 times, and then you get ORE for another 5 times. You get 10 times then.
Yeah. Okay. So ORE,
you don't pass in that 10 times. You're not fit anyway to work as a dentist.
Right, exactly. So like ORE part 1, part 2, separately, like 5 times, or
no, just one particular one. So part 1, 5 times, part 2, 5 times.
Okay. And in part 1, is it like you said, theory examination? So do someone has to like brush up all the concepts, or are there like separate sections that from this part, it'll be like 30% exam, or how is it?
No, it's again, there is syllabus is in the GDC website. They'll ask you only from that. There are a few books and things there. They only suggest for you to read. There's a pink book. It was a Bible, pink books, and there are other, there are lots of books which they have. I forgot the names.
They have given a reading list that I've seen on the GDC website, but that's quite a lot of books. So someone has to go through all the books, or it's.
There are a few books which is I forgot the names of the books which I did it in. It was definitely the clinical handbook. Oxford Clinical Handbook is we call it Pink Book. Problem Solving in Dentistry. For anatomy, there is another Moore. It's a beautiful book actually. And a few other books I forgot. There's another one I forgot. Gosh, yeah, it was long back in 2008, 9, that time. There are a few, again, as I said, in the Facebook groups, in the ORE part 1 discussion group, you can put all that questions and they will be able to help you because they have just done it or just doing it, and they will help you anyway.
Okay. And the MSc course, the one that you said for clinical dentistry, is there any pre-requirement that one should have an MDS degree or BDS degree?
No. There's nothing like MDS degree or anything, just the BDS degree. The IELTS, obviously, you have to pass, but not as strict as the ORE. It can be academic, but it don't have to be, I think it's 7 overall. No, yeah, not sure. It's 6 overall or something like. It's very, very lenient, not like the other one.
Okay, and when we talk about the total cost, that includes the ORE part 1, part 2, the visa process, the application, fee, and
minimum 5,000. Minimum 5,000 pounds.
Okay, the total cost.
That minimum, and the maximum can go anywhere. Depends on how many times you're sitting for the exam.
But also, I
Minimum
would like
cost.
to know the accommodation part. So suppose somebody is coming on a tourist visa and there's, that cost also someone has to bear.
Yeah.
So how
So it's 750 for the part 1 and 200 and 2,000, almost 3,000 for. So that itself is gone like 3,750. Then you need to look at the flight charges. You need to see the accommodation charges, and then how many times you. So minimum itself is, to start with, you need to have at least £5,000 to even think about doing this.
Okay.
That's the basic.
Okay. And is there any kind of loan that the thing is provided? Somebody can come with a loan and then they can do it.
They can get the loan from India, but I don't think you get any loan from here. No.
Okay.
You can get, yeah, if we can get any loans from India, yeah, that's absolutely fine.
Okay, that's great. I think most of the questions we have covered, and thank you so much for your time, Dr. Roshith. Shivani, would you like to add something?
Add on anything?
Yeah, just one thing I would like to add on is when dentists come from India, they think they want to work in the major cities like London, Manchester. Everybody wants to live in London. The only tip I would say is for the first 2 years, try and relocate in the outskirts. Don't look for the major cities. A, it's very difficult to get a job in a major city. B, or simple thing like occupational health, because you need to get your blood test done in UK. For PLV, there's only a place, which is Wales, who accepts the PLV application without getting the blood test. So look in outskirts, not in major cities. That way you would save money when you come to UK, and you learn more money as well. So that's the only tip I would say.
Yeah, because absolutely good point, actually, Shivani, because a lot of people, but if you are flexible to take up any job in any rural area, you will get a job very, very quickly. If you are adamant, oh no, I can't do that, I can only work, my husband is here, that is where you get into the trouble.
Yeah,
Okay.
right. Okay. I think it was a very good session. And thank you so much, Dr. Roshith and Shivani, for sharing all the insights. And I'm sure the audience will get more idea on how they can start practicing, or they can start applying for ORE if they want to move to UK and settle down as a dentist.
Tony, is there anything that my dentist will be doing to promote more dentists from India? Anything that they're planning?
Yeah, so currently my dentist got a plan. They'll be recruiting a hygienist from overseas. So people who have already registered with the GDC as a hygienist or a therapist, we are giving them jobs and giving them tier 2 sponsorship, and would help them to pass some monetary help when they come in the UK for the accommodation, and help them to pass the ORE. So that's the drive they're doing currently. So if anybody is already registered with the GDC, I can share the link where they can apply for the job.
Really?
Okay. Can you just move to the My Dentist slide where you showcased about yeah. So okay. So when you say that you're providing jobs and everything, so are you also taking some payment for the job? So it's like how is it?
Nobody taking any payment.
Okay,
so is it a job portal? I mean, I want to know more about it for the audience because they might be having questions related to that.
So the best way is to Google up My Dentist, and also we have a YouTube channel as well, and I can share it with you, the job we have live currently. That's the best way. And if anybody says to you that we'll charge you money to get your job, never go there. It is totally free. They'll gain from overseas dentists coming to UK. Instead, they want overseas dentists. So My Dentist is one place where they actively recruit overseas dentists. So.
Oh, okay, great. So yeah, thank you so much for sharing all this, because I'm sure this is definitely going to help the audience. And thank you everyone for patiently listening to our session today. I will be seeing you in the next session. Until then, please like, share, and subscribe to our channel, because if you share this might help out somebody who's looking to move to UK and settle down as a dentist. So please share this video with your friends and family. And course, don't forget to subscribe to our channel. I'll see you in the next video. Until then, bye-bye and have a great day.
Bye. Bye. Okay.
Bye-bye.